Good evening, everyone. Thank you so much for joining us this evening. We are so excited that you're here with us tonight. We have a special treat for you tonight, and so I'm super excited. Just to start, my name's Nikki McCutchen. I'll be your host. Just know that whoever invited you to this call must really care about you to want you to know about this technology. The call will be for 30 minutes tonight, so thank you for taking 30 minutes out of your schedule to be with us and learn about this amazing technology. We just want to get started with our medical disclaimer. Tonight, what we'll be sharing is for informational purposes only. All LifeWave products are not intended to treat, cure, diagnose, or prevent any disease. If you are on medications or have medical conditions or are pregnant or nursing, please check with your healthcare practitioner first. And tonight also, we're having Dr. Caroline on with us. I'm super excited. She obviously is not your doctor, but we are super thankful that she's here. And if you want her to be your doctor, we are going to share with you her website and all of that tonight as well. So definitely connect with her for that. But I'm just super excited. We're going to do a little bit different. We're just going to kind of pick her brain and let her share with us just what's going on with her, different things that she's learned, so she can share with us. But Dr. Caroline, if you will just start with, I wanted you to just tell us what it is that you love about this technology.
You know what? Like, there's so much to love, honestly. I will say one of the things that I loved when I first used it was number one, that it actually worked. It worked, and it worked without chemicals. It worked with energy and frequency. And I just felt like that was amazing and definitely correlated to what has been predicted for the future of medicine. And so I was like, wow, the future is now.
Mhm. Yeah.
So,
So when you
mhm.
say that it's the future of medicine, what
Mhm.
is it that you know about the information that you have that would tell us that what this technology offers is the future of medicine?
Well, I mean, it's been actually suggested um, that we will be able to influence our physicality, our physiology with energy, and as opposed to the way that we've been doing things, which
This is a doctor. It is part of that.
so yeah, so that was really the prediction, right? That we're going to be able to influence our physiology with just energy. And so that's what this is, right? And the last 100 years at least, I would call it kind of the chemical revolution, in a sense, that we moved into this era where we used chemicals to influence physiology. But unfortunately, that has affected not just us, but our environment in ways that are, really detrimental. And
Mhm.
so, I think looking back, we will see, like, wow, as much as we learned a lot through that whole experience, it's really not the best way to try to create change.
Mhm.
Yeah.
Yeah.
Hmm.
So can you explain to us how it influences our physiology?
Yeah. So the amazing thing about this technology is uh, David Schmidt, the inventor, created these patches that when you apply them, and what activates them is your own light, your own energy. And that basically stimulates the patch to send a specific frequency into your body to create a specific physiological response. And so there's many different patches. Just as an example, the glutathione patch, basically your own light, your energy activating that sends a signal to your cells to produce glutathione. So it can increase your glutathione production. What they found is up to 300%. That, coupled with the nutrition to support that, which is sources of N-acetylcysteine. I love the whole food sources. So that would be cruciferous vegetables. you need that as well. But those two things together, it can help stimulate your own production of glutathione, as opposed to which your cells are designed to produce glutathione. And that's the number one thing that helps protect your cells from damage of, again, all these chemicals, right? And so super important. And so we produce that on our own. This patch increases and supports your production of that, which is great. And obviously different patches do different things. You've got the X39 that helps stimulate stem cell production as well. GHKCU, right? That's the peptide that it helps increase, and that stimulates stem cell production. And most people on here, of course, know that those stem cells then could be made into any other type of cell for whatever the body needs for repair, right? And so that's really amazing. And there's other patches that as well that people can use that do different things.
Yeah. So do you have any interesting stories for us that we haven't gotten to hear before of people that you've worked with?
Yeah. So it's interesting. I have had an interesting story. I have my neighbor who is 78. He had some health challenges. He has type 2 diabetes, and he has some other things, but I wanted to just, as a gift for him for helping me out with some things, I was like, hey, I want to give you some X39 patches. They're stem cell patches. They'll help with improving stem cell production, which then can help repair your body and kind of reverse the aging process basically over time. And he was going to have a surgery on his hand. He had to have trigger finger surgery. And he'd been using the patches at that point for probably around 6 weeks. And so he didn't even think to necessarily send me a picture on his own of what was happening with his hand. But I just happened to check in with him, and I was like, hey, how's your hand doing since your surgery? And I want to say it was actually 4 weeks from the time they had a surgery. He sent me a picture of the scar, of the incision. And I was like amazed. It's actually one of the before and afters that we have of his, like, when he first had this surgery, and then just 4 weeks later, how much it had healed. Like, you couldn't even hardly see where the incision was. It was amazing.
Wow. And was he just using the X39?
Yeah, he was just using the X39, and that was it. Yeah, it was really
Yeah,
amazing. Yeah.
that's so awesome. Yes.
Mhm.
So
Yeah.
you and I were having a really interesting conversation the other day, just talking about how obviously we encourage people to go and speak with their doctors,
Mhm.
about this technology, and how they, if they, feel like it's okay for them to use it. Um, but obviously sometimes we get some interesting then responses with that. And so you were giving me some extra things that you thought is important for us to just put out there for people to consider when we're, recommending that, sure, yes, absolutely, check with your doctor first. But I just wanted you to be able to share that with everyone else because I thought it was really good advice.
Yeah, I mean, I've been in the healthcare industry for 24 years, and being in the alternative and holistic side of healthcare. Over the years, I've had, situations where patients will say something to the effect of, like, talking to another doctor they're seeing about, or asking them about some of the stuff that we're recommending. And of course, we do want to cross-reference other things that we're doing, because we don't want to do anything that would be contraindicated, for sure. We want to take responsibility in that regard. And we do certainly want everybody to be on the same page where these things are concerned. But I also would advise my patients that certainly you want to tell your whoever, that's fine, but don't necessarily expect them to know about this, because they are not going to automatically know and understand what this technology does if they haven't been educated on it. So if you're going to go to them and look for their opinion on this, they're not going to be able to give you an educated opinion on this, right? If they've never heard of it. So they could be, they're going to tell you something, but that doesn't necessarily mean that it's an educated opinion, right? And I deal with that a lot also with some of the nutritional support that I will give people as well. So it's something I'm very used to. And so I feel like a lot of people don't necessarily think about that, right? Because I feel like they think that their doctor should just know everything. But doctors, depending on their training, right, is really relative to what you want to ask them. You shouldn't really expect them to know about things that they have no training on, if that makes sense. So when you're talking about the allopathic aspect, their tools are drugs and surgery for the most part. They're going to know about that for sure, right? That's their wheelhouse.
Right.
Right. And so, but when you're talking about, other types of support, they're not necessarily going to know that. That's why also that they wouldn't recommend it, because it's just not their training, right? And so that would also apply to this technology as well. So I think it's really important to have some awareness around that. Yeah.
Yeah.
Have some
Such good
discernment
advice.
around that.
Yeah.
Yeah.
Yeah. So in talking about that, then, are there any contraindications with this technology that people kind of need to be aware of?
Sometimes there are, sometimes it's case by case, but there is one. So if somebody is going through any type of chemotherapy or radiation treatment, it is not recommended that they use something like glutathione in any way, shape, or form, as far as like whether it be an oral supplement or the patch or any glutathione whatsoever. And that's because, again, what is the glutathione supposed to do? It's supposed to protect your cells from anything that would damage them. And if they're going through a chemotherapy or radiation treatment, you want that to be able to affect the cells, right? The glutathione might kind of interfere with that. And so if they weren't going through that type of treatment, then it's not contraindicated to use it with, somebody that has cancer, but you just don't want it to interfere with that treatment, if that makes sense. You
Yeah.
know? Um,
Yeah.
right. And so, that's a typical one. Just trying to think about some of the other ones, if it's contraindicated. Again, some things are going to be case by case, right? Relative to a specific individual, right? And so, yeah. Sometimes I think one of the things you were going to ask me too is, well, let me ask you if you want to know this. Sometimes what somebody could experience with using the technology when they
Yes. Yeah. I was
start
going to
using
ask
it.
you about reactions. Sometimes we get people that kind of have, unusual, reactions sometimes
Mhm.
that wouldn't be, just normal detoxification, that are pretty general headaches, tiredness, maybe a little bit of rash, things like that. But sometimes there's some that are a little, more, I don't know what the right word is, but I would love for you to address that for us as well.
Yeah, and I mean, I could speak generally. If you have like a specific situation that you want to ask me about, you could that as well. But there are situations where some people are very sensitive to energy and any kind of energetic influence, and so their response is going to be relative to them, and it's also going to be relative to what kind of condition they are in to begin with. And so, everything is relative. And so
Mhm.
that's what I mean by that is everything is about relationships. Nothing exists in isolation, even though we learn about it that way. But the reality is it's not, nothing is in isolation. And so if somebody puts on the patches and they have an unexpected response, you have to look deeper at what's going on with that individual, number one, right?
Mhm.
There could be some other things as to why they're responding that way. And so we've had a situation like that where somebody what appeared to have be kind of an excessive, what you mentioned, like detox reaction.
Yeah.
And it did have everything to do with their level of toxicity,
Mhm.
right? It had a lot to do with that. And so in those type of situations, it doesn't mean that they can't necessarily use the technology, but you might want to work on the other things in addition to this, and you might want to use the technology where you're not necessarily using the patch every day relative
Mhm.
to their tolerance. It's kind of similar to like the way that we would, maybe use certain nutrition or herbal approach with them. We might use
Right.
a smaller amount to allow for the tolerance to take place. Like, because if they have a lot of toxicity, for example, you don't want to overwhelm their system with releasing a lot of toxins where their elimination organs cannot handle that.
Right.
So there was a situation where we needed to open those pathways of elimination before we started mobilizing a lot of toxins. And because they were responding to that, there was a mobilization that was happening. It was clear that their elimination pathways were just not effectively open. So there's ways to do that. There's ways to open those pathways. And sometimes that's a process. And so it doesn't necessarily, it's not a bad thing that they responded in that way. It was actually, in my opinion, kind of diagnostic in and of itself that,
Mm.
hey, this is actually good because now we know this and now we can do something about it.
Right.
Does that make
Yeah,
sense?
yeah, and I just it's so great that you say that because it really is positive. And so trying to help people, it's so our society is so built on, if I have some sort of symptom, then it's really bad. When the
Right.
reality is when you have things in your body that need to come out, there's going to be symptoms for them to come out. And these are good things because then, we have the tools or we have access to, like you said, these other pathways that need to be opened up. So it's an indication of we're headed
Yep.
down the right road. We just need to go slower. We need to maybe add some other things. So I know, we've had some people that have had some, feelings of heart fluttering. I had a person who was just itchy all over their entire body, like very, very quickly after putting on the patch. So different things like that aren't necessarily common. Like you
Mhm.
said, it's just an indication of it's actually a positive thing, and getting people to how tell us how would we get people to try to understand that this is actually a positive thing for them.
Well, I think it's really just having a conversation around that. I think in this situation, where this happened with one individual, where it's very clear that that was going on, once we had a dialogue and a conversation, then, it made sense because it made sense to that person. And because they had a history, right?
Mhm.
They had this history. And so understanding, oh, okay, well, this is certainly supports what we're talking about, right?
Right.
And they had a history. I mean, that also had everything to do with why the patches were recommended for them,
Exactly.
right? Because they
Hmm.
had a history of challenges and were not getting better. And so
Right.
this, in my opinion, had everything to do with why that wasn't happening. Because when your system is so overwhelmed and overloaded to such a degree that you would respond that way, that's been building for a really long time. And
Hmm.
it wasn't getting better like on its own. It that needed to be addressed. And
Yeah.
so how that person responded was evidence of that. And
Yeah.
so I feel like it just requires that. It's having a dialogue around that to have
Hmm.
a deeper understanding of what's going on. Right.
Right.
So and I mean
And now
go ahead, I'm sorry.
Yeah, no, you're good. Yeah, so now they have a tool in their toolbox that's actually going to allow them or allow their bodies to begin to walk down that detox process. It may just
Mhm.
be that they need to go a little bit slower. And
Yeah.
that's one of the things I love about this technology is
Yeah.
you just take off the patch. Like it's not ingested, it's not in your body. You don't have to wait for it to go through all the systems and the
100%.
processes. You just take it off.
Exactly.
Yeah.
Exactly. Yes. 100%. And I know there's people on here that can relate to some of what we're talking about, because good example was some of what I recommended for this person. They were using a combination of patches, or at least the X39. I know that. And then I suggested, they needed some additional nutritional support again to help with this. And a few other things, but my recommendation was to open the four gates, like use the patches to kind of help open the four gates, for example. That would help with these pathways, so they could continue to use the patches, but it was going to be in a different way than they originally had thought, you know.
Right.
And
Yeah.
but this is good, because that's our job is to help um customize this to an individual based on their specific needs. And sometimes you don't always know, because right in the get-go, because you don't really have a history with the person. But as long as somebody's willing to communicate, I mean, the great thing is, and I always encourage people, please communicate with me. When you start wearing these patches, absolutely communicate with me. And if they're coming from a place of, oh my gosh, what's happening? This is negative, or this is bad, I'm like, okay, it's going to be okay. Right. Uh,
Mm.
like you said, don't worry. We can just take the patches off for now. Let's just try to understand what's happening here, because it could
Mhm.
be an opportunity for awareness. The fact that this happened is actually a good thing, because it's an opportunity now for us to kind of understand what's happening with you.
Right.
Right. Because if it was just the patch, why isn't everybody have that same experience? It's the
Right.
patch relative to you as an
Mhm.
individual. And so what we want to understand is what's happening with you in terms of how or why you responded this way.
Right.
So, it could be the start of somebody going down a path of dealing with things that there's a need to deal with them for a very long time, but it
Mhm.
had not been identified until they had that experience.
Right.
Right. And so,
Yeah.
yeah, so can be a very positive thing. You mentioned about heart palpitation. So that's another thing. Somebody could have a lot of different reasons for heart palpitations, just like somebody can have a lot of reasons for anxiety and depression type symptoms. It's not just like one thing that can contribute to that. And it's not even just the mental and emotional that can contribute to that. I'll give it a good example. So I have a new patient who, she was desperate. She has a toddler. She was having significant mental and emotional. She would have these episodes. They were like episodes. They weren't like all the time. They were episodes where she would really start to spiral into have anxiety, but also spiral into depression kind of all at once very quickly. And her experience of that was, and then she would have a physical response to that. And her mentality around that was like, I cannot live this way. So it was kind of a very, we had to act, right?
Mhm.
So when I did the evaluation on her, a lot of what was happening had to do, or it was around blood sugar. She had been started some of the semaglutide uh, shots, and along with intermittent fasting, and it had really messed with her blood sugar significantly. And so that's why I'm saying, like, you can experience mental and emotional challenges, and it is actually physiological. But again, somebody that doesn't understand that wouldn't put that together. They just know
Mhm.
how they feel. They just know what they're going through. And so I had to just get her blood sugar balance as quickly as possible, as consistent as possible. And the point about that is, um, she needs that anyway, right? This whole experience that she had is what brought her to me. But like now we're going to get her on track where it's going to benefit her as a whole. it's going to benefit her in significant ways. And, just understand that sometimes people will experience these things and it's not what's causing it is not necessarily what they would necessarily think on this surface. Right.
Yeah.
That's why you need to take a deeper look. So regarding that's why where I was going with this, regarding the heart palpitations, so many things can contribute to heart palpitations. If somebody, again, how popular is intermittent fasting? Really popular. If somebody is hypoglycemic, and a lot of people don't really always know what that looks like, but if you go too long without eating, or there's too much time in between meals, if you're doing that consistently, you're experiencing some hypoglycemia during the day, 100%. Just hypoglycemia can affect your heart. It's a big, sorry, I don't know what's happening here with my screen. I know. I think it's because it's that kind of got dark in the room. So
Yeah.
give me 1 second. I'm going to keep talking, but I'm going to turn the light on. Hold on.
Okay.
Okay. All right. I think that's better. Yes, that's
There
better.
you go. You're fabulous. Yes.
So, I bring that up because I see it a lot. I see it so much where people's blood sugar is not stable. It affects them mentally and emotionally. It affects them energetically. It affects them on so many levels. And it affects your heart. It affects that, right?
Yeah.
Also, whatever's happening with somebody's thyroid can affect their heart. Like there could be underlying things that are happening with the person, and and yes, okay, you could apply a patch and it could accentuate that potentially, but it doesn't necessarily mean that it's just the patch alone. And really, because we want what's in the best interest of people that we're working with, we really want to look deeper into that. We don't want to not do that, because that, to me, that just doesn't serve the individual as a whole.
Yeah. Yeah. Oh my goodness. I would love to go down the rabbit hole with the semaglutide with you, but we're not going to do that, even though it really makes me want to that you brought that up. That's amazing. But we have a couple questions for you. So if someone is taking the chemo pills after chemo, can they use our patches?
Yeah, absolutely. Like if somebody's done with their treatment, they're no longer doing chemo or radiation, and they've been released from that treatment, actually, I think they should, right? Because part of the reason that could have contributed to them developing the cancer in the first place is because they didn't have enough glutathione to protect their cells from all these things that can cause damage,
Right.
So you really do want to, that's a reason to start using, especially the glutathione patches. It's just, let's get that glutathione increased and back up to a level that's going to help protect that person's cells from the things that damage the cell that leads to cancer. 100%.
Yeah. And another comment, what about someone who's had an organ transplant?
Yeah. That's a good question. So it's typically not, it's typically contraindicated. Anything that's going to strengthen the immune system is typically contraindicated with organ transplant, because that person has to be on medication to suppress the immune system. And yeah, unfortunately, that is true.
Yeah. And I had one other thing I wanted you to talk about that we've talked about before. So how do you use the HSAs in your practice?
Oh, okay. Yes. So yes, because I am a healthcare provider, we can use HSA cards to pay for treatment. That is true. Yes.
And that can be utilized with people's patches then because they're working with a practitioner.
Yeah, I mean, we would just do it where you're purchasing them from our office. We would do it that way if they chose to do it that way, or they needed to do it that way.
Yeah.
Yes, you could do that.
Yeah. And so, yeah, with that, everyone, I really wanted you to know that Dr. Caroline mostly works with people virtually, so it can be anywhere. I just highly recommend everyone has a functional medicine doctor as well, because I think it's so important to get that other side of health, and that's really encompassing root causes and not just symptomology, and have another opinion that's not identical to the mainstream medical. So her business is called Native Sun Nutrition. She's got an amazing website. Please follow her on Instagram and Facebook, Native Sun Nutrition. And like I said, she can work with anybody virtually. And I just think it's so important. Like I said, I cannot highly recommend enough that everyone has a functional medicine doctor that they are getting information from, along with whatever course of treatment that they are going down. You really need that other side of the opinion to try to get to root causes. Everything that Dr. Caroline talked about, really understanding symptomology, that's not just treating a symptom, but let's find out why, like what's causing this, what's going on deeper in your body. Like she said, we treat things individually, and that's not how our bodies work. It all works together. And functional medicine doctors do that really, really well. So definitely want you, yes, Native Sun, SUN, that SUN Nutrition, Native Sun Nutrition. And then there was one more, let's see.
Okay. I was
What
going to
about,
add to that
oh,
too, what
please
you were
do.
saying.
Yes.
Yeah. So, so I get a lot of questions in regards to, oh, okay, what kind of patients do you see? I see anybody that has any kind of problem. And why is that? Because I'm providing an alternative, right? And as you mentioned, Nikki, we are addressing cause and effect, right? Like I'm not just trying to suppress your symptoms. I'm not just treating symptoms. I'm actually trying to make you a healthier human being. I'm actually trying to, the amazing thing about how we were designed and how we were made is that our bodies are constantly recreating themselves all the time. And so there's not a lot of thought that goes into how we're supporting ourselves ongoing with that recreation. But I do. I think about that when I'm working with someone. I'm setting that person up for becoming a new individual in reality, right? And we do look at where they're at, obviously, like, that's another thing too. Like I use a lot of diagnostics to kind of see where somebody's at. Like we'll use obviously your subjective data too. But that's just your conscious awareness. And there's so much happening with a person that they're not consciously aware of. And so we want that information too, because otherwise we're doing you a disservice. And so the diagnostics really help with that. And so, looking at your blood, looking at I look at a tissue analysis as well. That helps me see how your tissue is being compromised to even idealize your blood, which I think it's a very diversified way to look at things. And those are the minimum of what I do. But if we need to look at what's happening in your gut microbiome, we can do testing for that. If we need to see if you're reacting to specific foods and have a lot of inflammation in your body because of that, we'll look at that. I mean, there's so many things that we could look at to see what do we need to change. And there will be no question about that because, we've got the data right there. But there's been testing that I've done on people and they had no idea that they were at high risk for developing cancer. And it's so easy to change that before it ever manifests. Like, why wouldn't you want that information so that you could work on it before it ever happens? And then we can take you down a path where it never happens. But that's what I want. I'm not on the side of things where we're putting things in your body that actually is causing illness. I'm not on that side. I'm on the other side.
Yes,
Just
which
saying.
is why we need this opinion. Everybody needs to have a good functional medicine doctor.
Well, 100%. And please do not think like, how many people have said to me, oh yeah, I had my blood work done and I was told it was fine. And I'm like, but you have to understand that not everybody's going to interpret your blood work the same. You're going to have different doctors that have an absolutely different interpretation of your lab results than another person. So that's why you mentioned, that's why you want to get other opinions.
Yeah.
Right.
Yeah, and especially the mainstream medical that we have, their idea of ideal for a certain vitamin, a certain nutrient, whatever it might be, is very different from optimal. Optimal health, what your body needs to thrive and function optimally versus just let's just get on by and here's your number. So yeah, it's so very important. And I love the fact too. I think this is, this is another service that those of us that are in this community that are recommending these patches to someone, we are going to see people with all of these different things going on with them, with their list of medications, with their list of symptoms. We're not, most of us are not doctors. We're not, but to me, this is about helping other people. So
Mhm.
if we can then refer to a doctor who is going to be able to encompass all the things and understands the technology of why we're telling this person this is so beneficial
Right.
and supportive to their body, and
Mhm.
then also have a doctor that can encompass everything. We have done these people that we have approached and offered this technology to an even greater service. And I
Mhm.
know pretty much every one of you that I know that we work together in this, our hearts are to help people. And
Yeah.
so this is not, for me, this is not just about a business that can offer this amazing technology, which really there's no product in the world that can do what our technology does. But there's so many other things that people need to begin to understand and put together about their health that is going to help them embrace optimal health.
Mhm.
And so I wanted you all to have that opportunity and have those things in your head and utilize these doctors, especially the ones that we have that are able to work with anyone virtually. It does not matter where they live.
Right.
For us to have like Dr. Caroline, just an amazing doctor that's working with us, that's teaching us, that we're learning from, but that we can truly benefit someone from all aspects of their health, to be able to refer them to her as well, and then them get from every angle of their health what they need. So yeah, I know we're over time, but I mean, it's just so good. Okay,
Mhm.
let me ask you a few more questions that are in here. So what about someone, uh, immunology, that is starting the process for kidney cancer?
Well, again, I think that would go back to what kind of
Same thing.
treatment are they receiving specifically?
Mhm.
Again, we don't want to be recommending anything that's going to interfere with their treatment.
Mhm.
It would just be in relation to what would support that. And so I would say you certainly not knowing exactly what treatment they're doing, um,
Yeah, he
you could
just said
certainly do
immunotherapy for cancer
okay. And
patches after or during.
Um, we for sure, there's for sure, I would say there's certain patches that would benefit that person, and that would be the Eon for
Mhm,
sure.
mhm.
You want to activate that part of the nervous system that would allow for healing to occur. So that would be huge. If they're not doing any kind of radiation or chemotherapy, then I would say that the glutathione I would think would benefit, right? Benefit
Mm.
them in that situation. Um, yeah.
Yeah, and
And
X39.
X39, yeah, could be beneficial as well. And potentially even the carnosine could be
Mhm,
beneficial as well.
mhm.
Yeah.
Yeah,
Mhm.
yes. Yes, so I know we're over time, and I know just a few of you got to ask questions, and thank you for putting those in the chat. But please go to her website. Please, sign up for a consultation with her, and just get on that journey of having a functional medicine doctor in your corner, that also understands this technology and just can start to help you put together some dots that maybe have been missing, and also just having an understanding of what true optimal health looks like versus treating every ill with a pill. So anyway, follow Dr. Caroline, Native Sun Nutrition, on Instagram and on Facebook. And thank you so much, Dr. Caroline, for coming on here tonight and just sharing your wisdom with us. We so very appreciate you. And so
Thanks,
we
guys.
just want you to get back to the person who invited you to call tonight. I know we didn't go deep into the technology because I just wanted to be able to pick Dr. Caroline's brain. But so please get back to them. They can get you any of the other information that they need. They can get in touch with me. They can get in touch with David, Pastor Ed, Vicky. So there's Mary. There's so many of us on here, Linda, that can help you with any of that as well. So we just pray blessing over each and every one of you. Thank you so much for joining us tonight. Thank you so much, Dr. Caroline. We love you so
Thanks,
much.
you guys.
Thank you.
Good
Appreciate it.
night.
Excellent.